Good afternoon, everyone, and welcome to the Wake County Board of Education work session starting at 2:30. We have a pretty robust agenda, so thank you for joining us a little earlier today than usual, and we are going to start off with work in support of the strategic plan. We've got Michael and Frederica from RTI here with us, as well as Beth Silvera and Dr. Gardner from the school system who have been working on this. Superintendent Moore, anything you want to add?
I think just to, and Dr. Gardner may be setting the context, but we had a session earlier with the board a month or so ago, and as we work on I feel like we've had the work on the strategic plan has been fits and starts over the last couple of years in terms of feedback we've gathered from staff and schools and principals and community groups and then the board. And I think today what we're hoping to do is really just start to get the foundation around some of the foundational pieces of the strategic format, the plan, and some agreement there so that we can move forward and update the feedback that we've gotten, the information we already have, and start making progress. So.
And this will be our first topic at our retreat on Friday. So thank you all for being here. Dr. Gardner?
Thank you. Good afternoon, Chair Mahaffey, Vice Chair Haggerty, Superintendent Moore, members of the board. It is a pleasure to be with you this afternoon, and I appreciate the comments that Superintendent Moore has said to set the context. It has been one of these events, as so many things that we've experienced over the last 2 years, that has had a start and go, and stop along the way with many interruptions. And so we're excited to be here today to re-engage in this work with you, the board, to set some foundational work that is going to be key to at least looking for the next year with regard to our strategic plan. And so I'm thrilled to be joined this afternoon from some representatives and consultants from RTI, who's going to help support our work as well. These faces are familiar to you and some of the work that they have facilitated with you before. I'd like to welcome Mike Martin and Frederica Nash. And of course, as you've already indicated, Ms. Mahaffey, staff member Beth Silvera, who also works in the Chief of Staff Division. Pre-COVID, we had a lot underway with a lot of momentum working with stakeholder groups in our schools, primarily with teachers and principals and students gathering some input about the current plan we were under, as well as mapping out the transition that we would take. And one of the big things that we encountered and tried to facilitate a study of our data, as well as a study of input of how it would inform us going into the strategic plan, the next version. A lot of that data is relevant at that time, and interestingly enough, after what we've experienced pre-COVID and going into COVID, is just as relevant, if not even more so. And some of that data we will share with you at different phases of this work that we will have with you. But today is more or less to set the foundation of what our transition will look like and kind of set that context of the work you'll do today, the work you'll do Friday in the retreat, as well as some work in the months to come. Pre-COVID, we looked at the data, as I told you, visiting schools, doing focus groups, and even in spring 2020 and going into summer of 2021, we were positioned to do very similar things with you and to bring you on board. And then all of a sudden we had whiplash and we were right back, the landscape changed again. Well, we feel like we're positioned as we were then. Now we're positioned to kind of re-engage and to begin to get your input about the board's relationship with the strategic plan, start looking at some of these foundational elements of vision, mission, and the core beliefs, and then begin to look at some of the data and input we've collected from our stakeholder groups, including you, the board, who have also had so much on your plate, to see how we begin to map out strategic priorities. We were very sensitive to what we were hearing from our schools, causing that pause. They just said they could not handle anymore with regard to what they were already doing to survive COVID, survive the school. So we were very sensitive to that and tried to take the pause we needed to take, the necessary pause in the work to let them survive COVID and still to meet the challenges that they're still facing ongoing right now. And the same as you with the board with so many things that we had to address. We hope we're at a position where to re-engage in that work now, and so we're excited about what we're going to do today. So at this time, I'm going to turn it over to Mike and Frederica, who are going to walk us through some activities and key questions to kind of set that foundational work going into the weekend. Great. Thank you again for allowing us to be here.
Thanks, Dr. Gardner. I appreciate that. Good to see you all again. So just to kind of pick up on what Dr. Gardner was talking about, I think so we're going to be with you for an hour today, and then for 2 hours on Friday. And I think today, with the time that we have, I think we want to kind of do two things, which is one, give you guys an opportunity sort of without the current strategic plan in mind, but just thinking aspirationally for what you as a board want for the students in this county to sort of think about what your aspirations are. And so we're going to do an activity to kind of think first about that, to sort of ground our work in kind of what we're thinking about. And then the second part of today, the hour that we have today, will be to think about process, and to really hear from you as a board about, how you want to be involved in the strategic planning process such that you can shape it and champion it moving forward. We think that part of, I do this work quite a bit, and I think it's really important to kind of hear from you and hear from you about the way in which the strategic planning process will work. So before this, staff lay out timelines and all the things that need to be done to move that forward, I think today and on Friday will be a chance to engage in a conversation both about our aspirations, but then also to get normed on process. And then, on Friday, I think we want to dig into some of the foundational documents. As Dr. Gardner was saying, we want to look at the mission and the vision and the core beliefs and think about them specifically, at this particular juncture in human history, right? And think about how that looks moving forward for the district and how it's reflected in the strategic plan. So our aims today are really to talk about aspirations and then to begin to talk about process. I do want to say, just with the time that we have, we expect to, talk about these two things today and hear from you and get your thoughts, but then also pick up on them on Friday to dig a little bit deeper, just given the amount of time that we have. So Frederica and I are really happy to be with you. I think we are also planning on re-engaging in some of the work we did previously. Obviously, that also was interrupted, but we're very happy and humbled to be here with you today and on Friday to do this work. So with that, I think I'll turn it over to Frederica.
Awesome. Thank you, Mike. And again, thank you all for having us here today. So we're going to start by thinking about some aspirations. But before we do that, I just want to reiterate, and Mike is passing around just a note-taker document that we want to hear from all of you, but we recognize that today we may not get to a closure on these discussions, but we will definitely circle back to them on Friday. So I want to make sure that that is clear with the time that we have. We just want to make sure that you will be heard and your the information that we collect today will be brought back up on Friday. So we want to think about the community and think about aspirations and dreams and hopes that you all have for the students and families in our community and what that means in terms of the work that we do in regards to the strategic plan. So we want to stage this conversation and prime it for when we get into talking about mission and vision and strategic actions later. So this is really to set the foundation. So we have two questions, and we'll take them one at a time for you all to think about and reflect on. So the first question that we have is around hopes and aspirations and dreams. So what do you believe are the hopes, aspirations, and dreams that the community has for its students? And I'm going to ask you just to take a few minutes to jot down some thoughts on your note catcher around hopes, aspirations, and dreams. And then I'll bring us back together and have a few of you share your thoughts. take another 30 seconds, and then I'll bring us back together. Okay, so let's come back together, and we will collect your note catcher for reference for the work that we will do on Friday. I failed to mention that. So as we think about this question around hopes and aspirations and dreams, as we start this conversation today to pick up on it later, what are some of the hopes, aspirations, and dreams that you all indicated on your note catcher? And we'll have just a few people share their thoughts.
Ms. Kushner, and then Ms. Carter.
Ask these questions today. I'm going to be a bit, not meaning to be flippant, but I would hope that our students would cultivate their own hopes, aspirations, and dreams in our schools. And the word that I always cling to is inclusivity, that our students are absent, doing this work absent of bullying and harassment, that they find meaning in their learning, and that they graduate to a future that nourishes their potential as a citizen.
Oh, I feel like what was just shared covers a whole lot. So, I mean, it was a very powerful statement. And I guess building off of that maybe is really how Ms. Kushner mentioned asking the students, and the question is what our community has, like what our community. So I know there was engagement done, but I think they're back to the drawing board, in my opinion, just because of so much that has happened with our students that we had no idea when, you mentioned when this work began, was even coming this way, and the impact on the students academically, their mental health, really looking at that, engagement levels, how do we re-engage students that, now are supporting their families, and how do we balance that, and stability, because there's been a lot of instability, and that continues to now. So that's just a little brief.
Thank you. Approaching it from that our community has, I think our community hopes that our students will have strong skills for post-high school life, be that college, trades, military, a positive experience in school with a comprehensive opportunities, including sports and fine arts, and also the opportunity to produce future leaders of our community. And we see a lot of students currently lead in different ways in their schools already.
So I sort of broke it down into 4 categories: citizenship, being aware and engaged, being future ready, and relationships. When I think about citizenship, I think there's a lot of hope that people will be good citizens, both local to global, in the community, in the state, in the nation, and globally. When I think of being aware and engaged, I think there's a hope that people will be aware of their environment, their society, the economy, their history. And of course, that goes to things like literacy and math, but I think, all of those are fit in some of those bigger pockets. I think people are looking for students to be future ready. We often hear about college and career ready, but I really think people are hoping that students will develop an interest and passion, right? Find a purpose. Schools need to be that place for exposure to opportunity. That's where kids learn about things that they wouldn't otherwise learn about. And then finally, relationships. I think people hope for schools to be a place where you develop both peer-to-peer and peer-to-adult relationships.
Thank you. Ms. Johnson-Hutzler?
Sure. I think everyone did a great job. Mine are clearly far more individual. I hope students can see themselves reflected in who we are as a district. I equally hope parents can see themselves equally reflected in who we are as a district. It is my hope that all students individually feel that they are getting what they need and that they live and go to school in a community that believes in them and have their best interests at heart.
Thank you, Chair Mahaffey. Again, I think we're hitting on a lot of common themes. I think maybe I started a little more basic, but then got to where some of you went. I started with academic success. Students should be able to demonstrate acquisition of essential knowledge, right? I mean, it's core fundamental purpose of the schools. College and career preparation, and I like Ms. Scott had added, military is another option there. Students will be prepared to move into a competitive world, whether it's competitive college admissions, competitive workplace, being able to distinguish themselves, and distinguish themselves from other candidates based on the skills that we've given them. I had safety and security, that our schools will be a safe place free of physical violence and free of social or emotional bullying. And then I called it something maybe a little less impressive, but just real-world skills, that students will be given the life skills and personal development that are necessary for success as an adult. Things like, as Dr. Martin had said, citizenship, critical thinking, financial literacy, communication skills, all of those things that we hear help distinguish our graduates from graduates of other school systems, and I think are key to success in life.
And in complete agreement with everything that has been said. Security and safety. I added social and emotional well-being of our students and those that support them inside and outside of the schools. Recruitment and retention of highly qualified staff to support our students. And family and community engagement were the other pieces that I'll add to that.
Thank you.
Chairman Happy, may I add one more point?
Yes.
I appreciate the focus on the community, given that as a public school system, the focus on all of our students, and given that 70% of those who support our schools with resources do not have school-aged children, that we have to. So I appreciate the fact that the question was toward the community as a whole. So thank you.
You're welcome. And I think that's really important as we think about this. And many of you mentioned students, and then I heard families, and I heard the community. So everyone who is involved and engaged in the school system is important to consider as we go through this process. So our second question, and some of you reached out to this, but to continue to think about it and dig a little bit deeper around skills and mindsets. So in order for us to be able to reach these hopes and dreams and aspirations that you all have mentioned, what are the skills and mindsets that our students need for success in this rapidly changing, complex, post-COVID world? What are some of the skills and mindsets that you think we would want to cultivate and develop and facilitate and have them lead with as we move forward? So take a minute and just think about what some of those skills and mindsets are. Jot those down on your note catcher. Again, if we don't get to share all of them, we will have them on that note catcher, and then I'll bring us back together to share. Please take 30 more seconds, and then we will come back together and share. Okay, so you all are thinking about the skills and mindsets that students need for success, and those are tied to the hopes and aspirations and dreams for families and students in the community. So we'd love to hear what some of those skills and mindsets are that you have thought about that are needed for students to be successful today, tomorrow, and in the future.
Ms. Scott?
I had resilience, but with the knowledge on how to support mental health. I feel we hear resilience a lot. We call upon people to be resilient, but I think that also goes hand in hand with understanding how to support mental health and self-care. Interpersonal communication, putting down devices, speaking to each other, asking questions. And then goal setting goals for yourself in life and staying the course and understanding how to stay the course with those goals in mind.
Dr. Martin?
So I'd start with really skills and mindset of fundamental literacy. Language, history, math, science, art, and hands-on literacy. So I consider all of those literacy, and it's not just words, but can we do anything? Can we work with tools, art fixtures?
Yeah.
The 4 C's of our previous strategic plan are as relevant today as they were when we put them there in the first place. Communication, creativity, collaboration, and critical thinking. I think it's really important to keep those. From a mindset, I think it's really important to have a growth over a fixed mindset. And that, I think, really means learning to shift the conversation from can I or can we to how can I, how can we. The simple can versus how can is really a growth mindset change. And then I'll again say, skills around relationships, peer-to-peer and student-to-adult. I think it's important to develop a mindset of respect and trust. I can't just demand trust, I can't just demand respect, but I have to develop it. And we need trust and respect so that we can challenge. We need to be able to do healthy challenge, right? It's not, everything shouldn't just stay where it is. We all need to challenge each other to do better, and that can happen out of respect and trust.
Thank you. Anyone else? We'll just go around in a circle? Okay.
Thank you, Chair Mahaffey. I would support what my colleagues have already said, and I also had compassion and empathy. I think one way to do that is through, as one example, truthful history and teaching our children truthful history and having representation in our literacy, in our choice of text. Flexibility, which kind of goes with a growth mindset. And agency. I think post-COVID, I think one of the biggest lessons I've taken away from listening to students during the last 2 years is that they want and I think deserve more agency in their learning and how we can, the educational experts can figure out how to do that, but to give students more agency over their own learning.
Thank you. So I think I had some similar ones, but I might have called them by different names. The first one I had was organizational and executive skills. And what I mean is the ability to self-manage assignments, due dates, and tasks. I mean, I think that's absolutely essential to success, whether students are moving out into the career world or into college. When they're away from home, when they're independent, they have to be able to perform tasks and do it without a lot of maybe some of the supports they receive while living at home or in schools right now. Coming after that, personal responsibility, the ownership of one's actions and conduct. I think that ties back to some of the respect and trust issues that have been mentioned. But it is also about, if we're trying to prepare students to be individuals, responsible individuals in society, we have to instill and reinforce personal responsibility. Critical thinking, I'd kind of mentioned before, but I think it fits here, the ability to independently review, analyze, and evaluate data. Communication skills, going back to those 4 C's, the ability to convey knowledge, meaning and intent in an effective and a responsible way. Doesn't matter if you have all the answers if you can't explain the answers to anybody. Community, and this one was a little more nebulous, but I think it goes back to the respect and trust issue. That I think that's what I was going for with this. But the recognition of one's membership in a larger community, the duties and obligations, but then also the supports and benefits of such membership. And then another one that I'll admit I took just from hearing the previous ones, growth and achievement, really that trying to create that positive entrepreneurial attitude for self-motivation and success. I think that would be very valuable if we could instill that in all of our graduates, all of our students.
And as with Mr. Haggerty, some of these will be echoes of what we've already heard. Critical thinking and the 4 C's. Dr. Martin, I put down functional literacy, which I think is kind of what you were looking at. Social and emotional well-being of students and staff. I wrote mirrors and windows because I'm just, students have to see themselves and also see others within the curriculum and other spaces in the school. Self-advocacy, student voice in learning, growth mindset supported by the adults around them, compassionate and caring adults in the school community, safety and stability, emotional intelligence. I think this pandemic has brought out the need for all of us to recognize that that is a skill that we all are working to develop, and more support for the well-being of our students. And that comes back to, where we are able to put our budget. I think the need for more counselors, social workers, we knew was there, but just got exacerbated with this pandemic.
I won't duplicate any. There are only 2 that haven't been said that are on my list, and that is negotiation skills, which is not something we ever talk about, but something that's necessary in being an adult. And then the other one is balance around healthy connections and relationships. So helping students, before they leave here, fully understand the complexities of relationships, which Ms. Mahaffey, I also wrote EI, emotional intelligence, around that. Those are the only 2 that haven't been said. And in terms of mindset, I think one of the things that grades do for students is remove the mindset. Growth mindset means absolutely nothing to any of our students. That's what we say. I think it's more about helping students understand how do they create their own mindset to understand that their entire life is a journey, and K-12 is a blip on the map. And so any failures that they've experienced is not an indication of who they'll be as adults.
All right, I'll try not to repeat, but I apologize. Some of them
It's
kind of
okay.
overlap with what you've said, but one thing, I was kind of specific on this, and I just want to state it because I think it's been covered, but one thing for me, I think, for so many of our students is how to focus on something in the midst of a chaotic time, and I don't know exactly how to word this, and to remain calm. How to be able to work on that, stay positive, and not... it's hard for adults to do, but I do think that is something that can help them if they learn that, early on as they progress through adulthood. And social has been said, sorry. Belief in self, self-advocacy, respect of others. And I put here part of that, and you just hit on a little bit, was how to disagree with respect and how to look for that compromise. And just because you disagree doesn't mean you can't be friends or you can't sit in the classroom and be kind to one another. So that was, to me, a big one. And the other ones have all been said, so thanks.
Thank you.
Thank you all once again. I think that the connections that you all made back to hopes and aspirations and dreams was quite clear without having to say this was the dream and this is the mindset and the skills that our students need. And so as we continue in this process and continue to think about these hopes and dreams and aspirations and mindsets and skills, we'll want to tie that to our path forward that we're going in terms of the strategic plan. And so I'm going to turn it over to Mike to have some conversations about what that can look like and sound like with this in the forefront of your mind around community hopes and dreams and aspirations.
Great. Thank you, Frederica. So if we are going to collect those sheets at the end, I think, because we want to kind of compile the data before we meet again on Friday. It's nice to hear so much commonality just when presented with that sort of really open-ended question. For the last part of our time today and then beginning again on Friday, we just sort of wanted to open it up for a conversation about process and about, the relationship of the board to the strategic plan, thinking about, kind of some of the specifics about how and when you'd want to be involved and at what level of detail, because we think it's really, I just do a lot of this work with boards and with staff, and just thinking about how we set the board up to shape the direction. And so I think that is the aim of the conversations that we've had with Dr. Gardner, is to think about, have a conversation on the front end, hear from you guys, how can we shape this plan to represent those you represent? Because I feel like that's ultimately the goal of a strategic plan. And obviously, there's very in the weeds decisions that you don't always know about, but there is much of a sense of wanting to have the board shape and drive, and ultimately for you all to be able to champion the strategic plan as your own. And I think that's part of, what Frederica and I hope to do today and on Friday is kind of think through that and make sure that you guys have an opportunity to think about that, and we can kind of capture it, like I said, before we put timelines down and sort of move forward. So I think the last kind of question that we just like to open it up with the remaining time that we have is, sort of what relationship you as a board would like to have in supporting the development and implementation of the strategic plan. So, that can be about, like I said, about when you engage in kind of, like, let's say, community involvement, right? There's community gathering, community feedback, when and where you want to be involved in that. So it's really an open question, and I think we'd love to hear your sort of thoughts. We're not going to have you write these down, but would love to just have you guys think about the question that's up on the screen right now and on your agenda.
Well, I'll say this.
Yeah.
When we all come onto the board and we receive our board orientation, there are very specific duties for board members. And, oftentimes we have to be reminded that some things might not be our responsibility. Those are more of an administrative or a staff responsibility. Development of the strategic plan is right there clearly at the top. And so we really should be, I think, heavily involved in determining the areas that are addressed by the plan, the priorities, the guardrails for what we look at, and then we'll rely heavily on staff and the community for what we think those things look like, how we measure them. But I think we have to be involved at the very top.
I'll just add to that, a complete agreement. I mean, the board, we are a governing board, we're not a managing board. And job number one for a governing board is strategic planning. So it really is, this should be in our wheelhouse. That said, I think it's also incredibly important that there is community input.
Yep.
Yeah, into a strategic plan. I think that was the genius of the Strategic Plan 2020. Dr. Merrill, I think, did a fantastic job of, creating the scenario where community input was gathered, because if there's community ownership, it goes a whole lot further than if it's just the board sitting around here telling you what to do, right? So it's a little bit of, democracy versus, more of an authoritarian. So it is our job to be governing, but that governing requires good engagement. Whether we specifically are in all the meetings or not, we need the information.
Yeah.
I think the board needs to be a little bit of a synthesizer and filter.
Yeah.
I think about, just because I think it might be good for me doesn't mean it's necessarily good for the system. The number of students that I get in chemistry class who took chemistry because a teacher or a parent said they should take chemistry, not because it's what the student wanted to teach chemistry, right? The educators, I think, need to have a little bit of that filter to say, hey, how about this? How about this? So I think we need to take that community input. The community input does not define the strategic plan. I think that's the governing responsibility of this board, is to take that, filter it, and strategize. The other thing that I think is really important that we do in the development of the strategic plan, and I completely concur with having asked the questions about student focus, but one of our jobs as a board is to make sure that the organization of the system functions well. I think, to its credit, the last strategic plan was heavily student-focused, and that is good. I don't want to diminish that at all. But I think something that was missing in the last strategic plan is we did not have sort of the fiscal, institutional, structural components that I think need to be there, whether we're talking about sustainability, budgeting, staff acquisition, hiring, retention, those kinds of things. I mean, even just your maintenance, are our buildings, is our physical infrastructure where it needs to be? I think that needs to be a component of our strategic plan. It doesn't maybe carry the same face that we're only focused on the students. Well, if we're going to be focused on the students, we need to make sure the system is in place so that we can focus on the students. So anyhow, complete agreement, but just expanding on some of those ideas a little bit more. But I think we really do need to be at the core.
I agree with that. I just wanted to add, to make it as inclusive as possible for feedback, for language-wise, time-wise, different options, whether it's a form, but make sure the form is accessible by folks. If we know it's in the system, their first language is X, Y, and Z, I really hope that is what we can communicate to them and have full access to that. And then if they choose, if we're having in-person or virtual meetings, to ensure that they have access to the presentation or anything in their language, and then also a way to communicate during the meeting and understanding what's happening. And I think I said, the time of day, maybe the dates. And I mean, I'm open to having it at back meetings, but I also think that's just one piece, right? To have it, because I think the more we can hear from our community, whether it's our staff, our students, or folks that have kids in the system, those who do not, is great. Anything that we can look at. And at ECHO, if we're not involved or not there, that we have access either to notes or whatever, if it's a recording, whatever it may be, just so that we will have the ability to review that information. Thank you.
All right. Any other thoughts? Okay. Thank you.
Yeah, and I think for us, so things I'm hearing, community involvement, and I think what I hear is sort of deep involvement, certainly from the kind of and this is what we're going to talk about on Friday, but the sort of foundational ideas, that is mission, vision, beliefs, and those are the things that we're going to start with as well. And then I'm hearing just a sort of touch points along the way throughout, shaping the direction of the district strategic plan. Anything else just on this particular sort of engagement in the process, and even specifics about the types of community involvement? I know you talked about positive experiences in the past. Would love to hear what some of those were that felt really meaningful in engaging the community.
Sorry, the vice chair is telling me I can go ahead, so I'm going to go ahead. And Ms. Mahaffey has heard me say this over and over again. Having had the opportunity to be involved in our last strategic plan, we involved our community in multiple ways.
Yep.
And I appreciate Ms. Carter saying perhaps back is one way, but we didn't split people that way because people see our school as a district, which we work hard to do that. And so we didn't split people by district. They were small focus groups really based on when they could attend them. So I think I heard the most feedback from people who were able to do focus groups. And by the way, we were not in COVID and people still did them virtually. However, we didn't have Zoom then. So I still think that that's a way to engage people because they're smaller groups and people feel heard and they're also able to hear what their other neighbors are saying, which I think is helpful. And then I think the large group, which is impossible in this environment, people just liked because I think it's actually where you saw people agree to disagree respectfully because we had hundreds of people in one space.
Yeah.
And people are far more likely to be kind when you create the environment that produces that. So since we can't replicate that, I would definitely say the small groups we are able to replicate those now, and people really found those useful.
Yeah.
Thank you, Ms. Mahaffey. And I would echo what my colleagues have said, but also to make sure that we are getting broad representation from our families, students, as well as business leaders, civic leaders. Make sure that we are, we have 12 municipalities, and they may have different input to our school district, just to make sure that we're being representational across the district in getting that feedback.
And I would add, our current students, but recent alumni as well, because I think they're there. So it's nice hearing what outcomes our business communities would like to hear, or institutions of higher education. But I think folks that have recently graduated from Wake County schools will also know it would have been nice if we had this.
Right.
Or we really appreciated that we did have this. So
That's the most immediate feedback that
absolutely.
is most useful. That's exactly.
So I'm going
a good
to
point.
say to our superintendent, which she probably remembers, that is the exact list that we used for the last strategic plan, literally. And for our alumni, we had somebody who was in college and somebody who wasn't. So we also had diversity reflected in our alumni who were a part of it. So you probably can just look at our old list.
So as we collect the input and even demand it, I think, of us, it's easy to give the list of we want this, 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 and this. But if we ask for a why behind the what, that can be really valuable, particularly as Monica was noting, right? So we hear each other, right? Because if I just give my list of I want this, I want this, I want this, I'm more liable to come up with sort of clashes with what you want. Mm-hmm. But if we give the why behind it, all of a sudden we listen a little bit more. And it's I think it's just a way to get some of that conversation as opposed to here is my stand, I want it my way.
Mm-hmm. I would imagine you two are familiar with this because you do work with nonprofits. We use theory of change in the nonprofit world, which requires you to create a guiding North Star. Mm-hmm. So to Dr. Martin's point, it doesn't matter what kind of questions you ask people, for those of us who use the theory of change, everyone knows this is the outcome. Yeah. And it does do, to your point, Dr. Martin, I think is extremely valuable to note, is when people know the why or where you're going, then it does, and there, of course, is always going to be tension, but tension isn't a bad thing when you, again, create the environment. So I completely agree.
Thank you, Ms. Johnson-Hostler.
And I think one of the things that, in our sort of support today and on Friday is just thinking about the aim of unification around, there's all of these sort of words about, North Star, but what is the constant thing that we will drive at as a district and articulating that. And that, I think that's the main task of what we're going to talk about on Friday, is to really revisit those fundamental documents that we have, the mission, the vision, the core beliefs, think about them both now and looking into the future, as sort of part of kicking this process off and moving forward. We really appreciate your feedback. I'll turn it back to you, Dr. Gardner.
Well, I just want to echo our gratitude to having Mike and Frederica here with us this afternoon, and we look forward to this partnership. We appreciate your input as well today. I think it sets a nice foundation going into what we want to do at the retreat, with regard to looking at some of the fundamental elements of our strategic plan, as well as some next steps regarding the involvement of our stakeholder group. So thank you so much for what you have shared with us today.
Thank you, Dr. Gardner, and thank you both for being here, for coming on Friday. And Dr. Gardner and Ms. Silvera, thank you for the work that you've done over these past couple of years to engage and to hear our staff when they needed a pause. And Ms. Silvera, you've been in this space for quite some time, and I hear you are moving on to a new adventure. So I just want to thank you for the work that you've done in Wake County for this, pushing this strategic plan and getting the ball rolling, but also your work on the past one. We certainly appreciate everything you've done.
Thank you for sharing that, Ms. Mahaffey. I was going to close out with that, so thank you for sharing. We wish her well. We're going to miss her terribly.
Yes, thank you.
Thank you.
Up next, we are going to the ever-changing quarantine guidance. I see Mr. Coe is going to be joining us, and I believe that we have some guests who will be joining us virtually. Superintendent Moore? Dr. Mashunga and Dr. Tilson as well. Pass those around. We are, yes. So, Mr. Coe, whenever you are ready, and I believe our communications staff has everyone else ready.
Yes, so good afternoon, Chair Mahaffey, Superintendent Moore, and board members. For today's presentation, I'll be joined by Ms. Karen Wade, Senior Policy Advisor for NCDHHS, who is in place for Dr. Tilson, and Dr. Nicole Mushanga, Associate Medical Director and Epidemiology Program Director for Wake County Health and Human Services, and also Kelly Creech, Senior Director of our Health and Crisis Prevention Services. They're all joining us virtually. And so I will share an update of our guidance considerations for COVID-19 and a high-level summary of the health guidance updates, while Ms. Wade will be providing COVID-19 response update from a state-level perspective, and Dr. Mushanga will be providing COVID-19 updates from the Wake County perspective.
Okay.
So I'm wondering if I should wait till the slides come up. There we go. There we are. And then so if we go to slide 2. So before we move into the bulk of the presentation with Ms. Wade and Dr. Mushanga, we did want to provide you with another snapshot of our COVID-19 health considerations for your information. And the slide that was uploaded to Assembly, the data is as of January 13th. However, checking as of January 17th yesterday, the data notes that 69% of students aged 12 to 17 have at least one dose of vaccination. And this language has changed on the DHHS website, but 66% of students ages 12 to 17 have 2 doses or 1 dose of Johnson & Johnson. And then 42% of students ages 5 to 11 have at least 1 dose. And 34% of students ages 5 to 11 have 2 doses or 1 dose of Johnson & Johnson. And for our staff, again, between 80 and 90% indicate they have at least 1 dose of vaccination per our staff survey. And for our positive cases, again, we've seen significant increases since December 27th-ish. And for our 7-day average, we are at, as of January 17th, 2,661 cases per 100,000. And our percent positivity is 26.44%. as of January 17, 2022. So while we've emailed you a more detailed version of the updated toolkit guidance, I did want to provide a high-level overview of the updates here. And first, as a reminder, there have been no changes to the face covering guidance, even though the quarantine guidance has changed. When students are outdoors, face coverings are optional. And when students are actively eating or drinking, they do not have to wear face coverings. And this includes when students are on days 6 through 10 after returning from isolation or quarantine. And the next subsequent slides contain high-level summaries of the toolkit updates. Please note that our latest and more detailed information related to the toolkit updates is always available at wcpss.net/when-to-return. And these slides are organized into the following high-level categories of if you test positive, if you are exposed to someone with COVID-19 and are up to date on vaccinations. And slide 6 had an error that was uploaded into Assembly, but it should read, if you are exposed to someone and you are not up to date on vaccinations. And so first, for individuals who test positive for COVID-19, regardless of vaccination status, are required to isolate or quarantine for 5 days. And if symptoms resolve after 5 days and there's no fever, these individuals no longer need to quarantine and should continue to wear a face covering around others for 5 additional days. And of course, in our schools, our face coverings are mandatory at all times, as we've noted at our January 4th monthly face covering vote. Individuals who have a fever should continue to stay home until the fever resolves. And for individuals who were exposed to someone with COVID-19 and are up to date on vaccinations should wear a face covering around others for 10 days and test on day 5 if possible. And that language is important to reiterate because there's no longer a requirement to test to return in that instance. It is more of a should and if possible on the toolkit updates. On the update, and individuals who develop symptoms should get a test and quarantine. And for individuals who are exposed to someone with COVID-19 and not up to date on vaccinations, they should quarantine or isolate for 5 days and continue to wear a face covering around others for 5 additional days. And if these individuals cannot quarantine or isolate, they should wear a mask for 10 days and test on day 5 if possible.
Mr. Koh, can you clarify when you say up to date on vaccines? Is that?
That means for someone has either the 1 dose of Johnson & Johnson or 2 doses of Pfizer or Moderna, and if they're eligible for a booster, are boosted.
So that would be ages 12 and up would also need to have the booster in order to be eligible
Yes,
for that?
ma'am.
Okay, thank you.
And within the window of the appropriate amount of time having passed since the second dose to the booster, because they may not have gotten to that period yet.
And then,
The heading on this one is if you were exposed to someone with COVID-19 and up to date on vaccination, stay home.
I noted that
Yeah.
that was an error, and it should say not.
Thank you.
Yeah, on slide 6. Yeah. So our apologies for that error. And then, so if we go to slide 7, so again, our latest and detailed information related to the toolkit updates is available again. I don't think I can say this enough, but wcpss.net/when-to-return. And that's a place where the public can go. And it's a public-facing website where most questions related to returning to the school or WCPSS buildings guidance can be answered. And so I'll pause here for any questions or dialogue before I pass it to Ms. Wade and Dr. Mushanga.
Okay, Mr. Haggerty and then Ms. Carter.
Thank you. So, Mr. Koh, I know that we report, I believe, our vaccination rates based on the data that is made available to us, but do we have any way to further break that down? Because, for example, if we're making decisions on different schools, middle school versus high school, for example, if we knew that vaccination rates at one was higher than another, or, you know, as opposed to just the age range, it would be more informative. Is it possible to break that down, or do we only get it in the 12 to 17 cohort?
I think it'll be something that we'll have to look into to understand, like, to what degree do we want to do the record keeping around COVID-19 vaccinations by school and have our schools be able to document that somewhere and report it to us at the district level.
just for clarification on that, the vaccine numbers, we only get that information from the Department of Public Health. We do not collect that data, so I don't know that even exists on a school-by-school basis, unless I'm mistaken. But is it correct that that data is only from the Department of Public Health?
Yes, sir. It is from the NCDHHS website.
And so to clarify, I wasn't necessarily looking for it on a school-by-school basis, but just rather these ages which reflect middle school or these ages which reflect high school. For example, if we're trying to determine vaccination rates in all of our high schools on average, we wouldn't necessarily need like the 12-year-olds.
Right, okay, so we have it sort of broken out,
Yeah.
but not quite as fine.
That's what I was wondering.
We have it in 2 categories instead of 3.
That's something we can discuss maybe with our public health officials about. Are we able to receive the breakdown of that data so that we know what maybe that up to age 11 looks like versus 12 to 18?
Okay, thank you.
Ms. Carter?
Yes, and kind of piggyback on that. I know that staff was asked about this, I believe, well before the booster was available. Is that correct? Has there been any outreach to see? Because now in order to, how the quarantine requirements are written or exclusion is, you have to be not just vaccinated, but with the booster. And I believe these numbers have stayed the same. Is that?
This is the data
Clarify.
from the survey that was done late fall. We have not updated it. We've been working on creating the portal that will ask staff to submit their vaccination status in preparation for whatever happens with the OSHA mandate that is stalled back on, I think stalled right now. So we're looking at updating it, whether we do it through that process or some other process.
Okay.
But that is back from the fall, you are correct.
Okay, right, because I just think it might be helpful with trying to understand some of the numbers with quarantines, with exposures, and what's considered exposure, and anyway, that's later on down the line. But the other question I had, I know they added the test to stay, so option, and I was just wanting to hear the feedback that staff is at now with that, and if that's something you all are looking at putting into place. I know we all hear, well, they got to test, how are we going to test? And the ability to be able to do that. But I just wanted to, since that is now in there, receive questions, and I would just, like to have that in there.
Yeah, so I just, Paul, please correct me, but the language around test to stay says should test.
Yes.
So there's not really a requirement to test to stay. It really just is, are you vaccinated or are you not vaccinated, or symptomatic or asymptomatic? Those are the questions that are being asked. And then anything about testing is should, which means that there's not a requirement and that the other questions actually drive what a staff member or student is able to do.
Yes,
I'd like to confirm
that's
that.
correct, Superintendent Moore, about the language is should and not required anymore. And it notes that we should test on day 5 if possible when symptomatic or have been exposed, but it's not a requirement per se to return.
I think that the data that was collected by the ABC Science Collaborative, who piloted test to stay across the state of North Carolina, and I think in other states as well, but the data that was collected allowed DHHS to make these revisions and make it a should with the test because the data was pretty strong in terms of what they received. So I think test to stay, I'm not sure if that's the best moniker for what we're actually doing.
And I guess the question is, because that's listed as a separate option and not linked to vaccination status, and not, the only thing it's linked to is mass required setting, if you're looking at the toolkit, and I don't see that reflected in our guidance. So that's why I was asking, because it doesn't say you have to be vaccinated. It doesn't say you have to. That's an option well above if you're exposed and the exemption is vaccinated. This one says exposure, exemption, test to stay in mass required setting, and I don't see it reflected. I'm looking at it now, that the student has to be vaccinated, or that the student or staff has to have a booster. So,
Yeah, so thanks for that question, Ms. Carter. So I know that's on page 16 of the toolkit, and those exceptions exist for school districts that are part of the test to stay program, which we are we are not yet that, and we've discussed it from time to time, but we know that it would take a great deal of effort at the school level, so it's something that we've discussed before, but we are not an official test to stay district, so that exemption would not yet apply to us.
Okay, so that helps clarify. So it's really not an option for our students is what I was trying to clarify, because saying it's a should and don't have to, but it's not something that we are looking at. That's what, okay.
Yes, ma'am.
And
Dr.
I can follow up
Oh.
further with superintendent on this topic. Thank you.
Thank you, Mr. Plummer. Dr. Martin?
Yeah, Mr. Koch, could you let us know? We got several questions about this. So the recommendation is you stayed home for 5 days. If you're asymptomatic, you can come back for 5 days. All the guidance says you should continue to wear a mask for that second 5 days. A question that we're routinely getting from families is, what about during meals? Some schools are having settings where children are coming on that second 5 days. This is not the whole school, but the kids coming back are having, smaller, more separated places to eat. Others seems to be just mixed in. But the guidance seems to be that for that second 5 days, you really should not be unmasked, even eating with other folks. So are we making any progress on having, instead of kind of a school by school, if we could have more of a district-wide plan for particularly that second 5 days to follow the guidance?
So currently, the guidance still notes, Dr. Martin, that one of the exceptions from having to mask is while someone is actively eating or drinking, and it's still not required while people are outdoors, even when they're on the 6th to 10th day of quarantine upon return. And this is a conversation I had actually with Dr. Mushanga. So I'm just wondering, Dr. Mushanga, if you're online and you can maybe address this prior to you presenting, just what you shared with me about the days 6 through 10 around masking. And
Like I said, the written guidance says even when you're coming back, you should not be eating and drinking in a collective setting. I don't remember exact the wording.
You're talking about the CDC language?
Yes.
Yeah, that when we follow what's in the toolkit is not explicit about that.
All right.
And I forget which page number, Dr. Martin, but it still notes that in the pages where it notes the exceptions to face coverings is while still actively eating or drinking. And even in the CDC language, I think in some of the emails we received from parents, there's a parenthetical in the statement that it says do your best, but masking is required as much as possible except while actively eating or drinking. So those are also pieces of the guidance that we're being cognizant of, and I think it is challenging, but I think it's the guidance is asking us to do the best we can, on those days 6 through 10 of quarantine as well. But Dr. Mushanga, did you want to chime in on that at all?
Yes, just adding that as we have spoken with the state about that as well, because there were concerns on day 6 through 10. However, it's minimizing the amount of time that particular child is without their mask. So they take a bite, they take their mask off, and they put their mask back on, or they don't spend a lot of time just eating, and then they put their mask back on. But it's really focused on if they're actively eating or drinking, they can remove their mask to do that.
Thank you. And thank you, Mr. Coe, and to Ms. Wade and Dr. Mashunga and Ms. Creech for being here to explain this. I think we all kind of feel like we need a new flow chart every time there's a new toolkit and learning about this. And so having everyone here today to answer our questions and hopefully bring more clarity, I think is helpful, because I think we all want to make sure that our students are safe in our schools and those that care for our students in our schools are safe as well. So thank you.
Yes, ma'am. So then to continue the presentation, I will now pass it to Ms. Wade from NCDHHS, who will present her slides about the state level perspective.
Great. Thank you so much for having me here. And as Mr. Coe said, I'm filling in for Dr. Tilson today. I work at DHHS in their policy office. And I'll be going through our trends, some recent scientific studies that are informing the guidance, and then walking through the guidance, and we can definitely talk about some of the questions that came up more in depth as well. So next slide, please. So just starting off, just a quick snapshot of where we are with our metrics. As I'm sure everybody is very well aware, we're unfortunately in a rising case rate right now, and you can see across all 4 of our key metrics, everything is rapidly rising. Over on the left-hand side, you can see the total number of cases and the positive tests that we're seeing, and the percent positive test shows that just even though it's not just the number of testing that we're doing, but this number, this high percent, the highest that we've seen throughout the pandemic, just shows how much virus is out there and how rapidly it's spreading. And then on the right-hand side, these metrics look at our current hospitalization and the percentage of ED visits. And really this rapid curve that you can see there is what's really causing the most concern. And as I know everybody is also aware, just the large strain that we're having on our healthcare system right now and causing a lot of concern. So everything is unfortunately at a peak that we're seeing, and we're hopeful that things will start to come down soon. Looking at previous cities and countries that have gone before us, we're hopeful it'll come down soon, but at the moment it's continuing to rise deeply. Next slide. And this just dives into our case rates across all age groups. And you can see it's a little bit hard to see, but they're rapidly increasing across all age groups, the highest being around our young adults at 18 to 24, but also increasing with K-12 age students as well. The group that's the lowest is our 65 plus, and that represents the percent of the population that's also the most vaccinated, but still everybody is increasing. Next slide. And this just looks more in depth around children, and you can see that it's increasing around all age groups, but it's increasing more around school age, K-12 age children than compared to our 0 to 4 child care children. So next slide. And so really what we're seeing is, of course, being that we're in the middle of winter and cold months and dry, there's increased transmissibility, but there's also the rise, of course, of the Omicron variant, which is building upon where we're already in a part of the year where people are gathering inside more, gathering in general more, and so there's really increased spread paired on top of it with the new rise of the Omicron variant, which we've seen is incredibly transmissible, 2 to 3 times as contagious as Delta, which of course was more contagious than the variant we've seen before. So it continues to just be rapidly spreading. When it first arrived around November, around Thanksgiving, it's now estimated to be at least 95% of the cases circulating in our region. So just tremendous shift in the number of cases being attributed to it. One thing that is a positive that we're seeing is preliminary data suggests that it's less severe disease, which is a positive for sure to see, but it's of course preliminary, so there's more to see, but that's what we're learning from some of the countries that had the first origination of Omicron, like South Africa and other places that have seen it earlier on than we have. And then just to touch a little bit on the impacts, unfortunately we're seeing decreased protection with vaccine or from the primary series, so your first 2 doses or your first dose if you had Johnson & Johnson, or from past infection. We are, however, seeing that boosters provide increased protection, which is why it's so important that everybody that's eligible to be getting boosted, which is ages 12 and up now, should be getting boosted as soon as they have reached their 5-month mark. And another change recently is that the CDC lowered the amount of time between when you should get your booster from 6 months now to 5 months after your primary dosage. So those are a couple things that we're seeing early research. There's, of course, given how quickly it's risen, there's not much out there, but this is just the preliminary data that we're seeing. Next slide. And so just to touch on a little bit more of our trends, this slide here shows what our hospital admissions by vaccination status, and it's just showing that unfortunately our unvaccinated individuals account for 80% of the COVID hospitalizations that we're seeing. So that kind of ties back to the less severity, but the importance of getting vaccinated and lowering the severity overall of COVID. Next slide. And then this just touches on our vaccination rates as well. You can see here at the bottom, this colorful graph shows ages 5 to 11 are at 22%, and then 12 to 17 are at 47%. And I know there was conversations about seeing if we could shift those numbers, and we can gladly take that back to see if we can pull the data differently for the group. It shows that certainly has been progress made, but there's a lot more progress that can be made. But on a positive note, over on the left-hand side, you can see where North Carolina is compared to our Region 4 states, which are our federal partner states, the way they break us up. And North Carolina is leading among our partners, but we certainly have more to do in terms of pediatric vaccination. Next slide. Great. And so I just wanted to touch a little bit on the scientific studies that are recently out there that give a little bit more background on what's informing the guidance from the federal level at the CDC and here in North Carolina at the Strong Schools at the state level. So just wanted to touch on that real quickly. So I've kind of already mentioned a little bit about this, but when the CDC recently announced their new isolation and quarantine periods, the shortened periods, which we'll talk about a little bit in a couple slides, they also released some findings that are informing the changes. And so I pulled some of them out here, and just that it's showing that data, including a review of 113 studies, show that COVID-19 transmission occurs early in the course of infection. Really kind of what's informing this new shortened period. It's also, early research is showing that Omicron has a shorter incubation period, which is defined as a time between being infected and symptoms are onset. And then what I was mentioning earlier, we're seeing hospitalization and death rates are much lower for vaccinated people for all COVID-19 variants, and that they're suggesting that the early data from South Africa, where the variant originated, are that they are lower for people infected with Omicron compared to other variants. So that's really where this information is coming from, that it's less severe, even though it's more transitional. And then this last one, which I kind of already mentioned as well, is that we're seeing less effectiveness for vaccines for Omicron, but with boosters, they do improve protection. Next slide. Great. And I wanted to touch on another thing that we've added to the Strong Schools Toolkit. I know there's a lot of information questions around masks at the moment, and so it's really helpful to have all the research available. So the CDC has developed a science brief, which really summarizes all the findings out there and research out there available on the studies that show and look at the benefits of masks. And they summarize the findings in this document, which is linked into our toolkit if anybody would like to read about it and learn more. And we just wanted to highlight one in particular, which is a new study out of Massachusetts looking at K-12 schools. And they saw a much lower secondary attack rate for schools that have a mask requirement versus those that do not have a mask requirement. Next. Great, and we just wanted to highlight a little bit of our data here in North Carolina. And this is looking at some data earlier, or at the end of the last year, about the K-12 clusters reported here. And just you can see that 47% clusters were, for optional mask policy, there was 47% clusters reported, whereas schools that have mandatory mask policy, it was 9%. And then for counties that reported a K-12 cluster, there was an average of 7.2 clusters in mask optional counties and 2.4 in mask required counties. So it's just helpful just to see what we're seeing here at the state level, the difference between those that are having a mask optional policy in place and those that have a mask requirement in place. And then, great, I know there was already some discussion around test to stay, so just wanted to highlight the new research that has come out about that. So the CDC has recently shared some new data about their pilots in school districts in California and in Illinois. And basically they were looking at schools that have universal mask requirements, and they were looking at students that had a mask-on-mask exposure. And so they saw a very low secondary attack rate and no increase in transmission in these environments. And this really supports the policy that we already have in place here at DHHS. As I'm sure you all know, in our Strong Schools Toolkit, there's already an exception, probably been there for a few months now, for mask-on-mask exposures, that the student does not have to be excluded from school as long as they were consistently wearing the mask. So this new research further supports what we had seen here in North Carolina, that this is a safe way to keep people still in the classroom. And so the other thing to highlight is the ABC Collaborative here in North Carolina had also done a research project. And it's similar to what the CDC was looking at, except for they were looking here, they enrolled 5 North Carolina school districts and 1 charter school over 6 weeks, and they were looking at schools that have a mask requirement. They were looking at unmasked exposures. So exposures that happen during lunch or athletics where people might take off their mask briefly, but are otherwise wearing their mask throughout the school day. And they also found, similar to what the CDC found, a really low secondary transmission rate and no documented transmission from study participant to another person. One thing that they did see is that the highest number of exposures happen during lunch, but the highest risk exposures, those that may ultimately lead to a positive test, are more likely to occur during extracurricular activities, which is something that I think we've seen, that those can be higher risk activities in general. All right, next slide. Great, so basically all this new research has helped inform our latest update of the Strong Schools Toolkit, which came out a week or so ago, which incorporates these new changes to really strike a balance between balancing risks to make sure that we're keeping people safe and keeping students safely in the classroom, but also adding extra flexibility, because we know it is very difficult with the rise of cases to make sure that we're providing flexibility to help schools and school districts find the best approach to make sure that their students can remain safely in the classroom, and their staff and teachers can also be safely theirs too. So next slide. Great. So, and it's just important to highlight that all the data that we're seeing really continues to emphasize these 2 key prevention strategies, that vaccines and boosters and important strategies and useful strategies to be able to achieve that goal of keeping people safely in the classroom. And so we continue to emphasize that these are important, along with a layered approach with other additional strategies in the toolkit, but these just really remain the most important strategies. So we really wanted to elevate that. Next slide. Great. So, and I think everybody's already probably familiar with this, but the CDC had announced new changes to their isolation and quarantine guide, reduced the timeline that people need to isolate and quarantine to 5 days. So individuals that have COVID should isolate for 5 days, 5 full days, and then wear a mask for an additional 5 days. And then people that are exposed to COVID should quarantine for 5 days and then wear a mask for an additional 5 days. And there are some exemptions, as you mentioned earlier, people that are vaccinated against COVID-19, and that includes boosters for adults. So that does not include boosters for children, even though the CDC has recently approved that boosters for 12 to 15-year-olds, or 12 to 17-year-olds, excuse me. This is still a difference between boosters for adults, or what you consider to be up to date, but for children under 18, it is just your primary dose. And then anybody that has had a positive case for COVID-19 in the past 90 days are also exempt. And then this last one is specific to K-12 settings, is that individuals that are consistently wearing a mask during exposure are also exempt. And so that's, like I said, our policy that's been in place for a couple of months now. And next slide. And then this is another change here that we're making on the state level, separate to what the CDC had announced. And this is what we're calling our new guidance on test to stay. And so building off of that research that we found from the ABC Collaborative, in mask required school settings only, individuals who are not otherwise exempt from exclusion. So we're talking about individuals that have not had COVID in the past 90 days and are not up to date on their vaccine, do not have to be excluded from school after an unmasked exposure. Individuals should get tested on the day of notification and as close to 5 days as possible after exposure, and wear a mask in school setting. And what we want, and I heard conversations about this earlier on the call, is that We want people to get tested. We recognize there's shortage of testing supplies right now and that it cannot always be possible. So if tests are limited, we recommend prioritizing exposures during athletics, because going back to that data that we saw, those seem to be the higher risk activities around extracurriculars. And this change applies to exposure of school, but does not apply to in-home exposures. So if it's a sibling, that would not apply, but if it's something, a friend they were hanging out with outside of school, it would apply. And then outside of school, we recommend that individuals continue to follow that quarantine guidance on the previous slides. So just stay home, do not attend other non-school activities, and wear a mask anytime you leave the house. And I think it's important to note that we'll just continue to monitor the data with Omicron and see if there are any changes. And then also, it's also important to note that this is, as I mentioned, it's built off of the ABC research out there. And it was, their research was only done in mask required school settings. And right now they're looking at mask optional settings. So once we have that data, there could be additional changes coming forward, but without that data, it only applies to mask required school settings. And I think that might be it for me. And I don't know if we want to take questions or if you now or move to the next.
The plan was to pause here for any questions for Ms. Wade from the board.
Okay, thank you. And thank you for your presentation today. I appreciate everything that you've laid out for us. I did have just a couple follow-up questions based on some of the slides. On page 18 of the slides, I appreciate you including the link that had all of the studies that you were identifying and referring to. I thought that was very helpful. When you go to the linked information, it does look at studies in terms of effectiveness of masks, potential harm or anything from masks, and goes through all of the research that's presented. I wanted to ask you, have you found that, are there examples of what I would say, even if they're rare, legitimate needs for a mask exemption that's health related?
I have not seen anything myself. I'm happy to take that back to our team, but I have not myself.
Okay, thank you.
And then the summary, sorry.
Oh, no, go ahead. I had some other questions. You go ahead and finish.
The summary also of the articles also looks at like the non-medical impacts, or at least not the non-COVID impacts, the behavioral, and it does not find any negative associations.
Okay.
I'm happy to pull some of that research as well, but.
I appreciate that. On page 20, as we talk about athletics, this is a question that I've gotten from some parents. We do see more incidents of COVID cases in schools among students on athletic teams. Some have questioned whether this is correlation or causation, and I was just wondering about your confidence in those being linked.
Yeah, so with the ABC Collaborative, they did find that even though that there was higher numbers of exposure that happened at lunch, the higher risk, or the more likely for a case to be a positive was if it happened during extracurriculars or athletic activities. And I think just what we see with the higher risk of panting and breathing and potentially spreading, transmitting COVID because of the nature of the activity, I think it's always been considered more of a higher risk. And for students that are that do have an exposure, we want to make sure that they continue to wear a mask. And if they're unable to wear a mask and they have been exposed, they should not be participating in athletic activities.
Okay, thank you. And then just the last couple ones. Again, when we look on page 23 and we make the distinction in the exemptions, when both people consistently were masked during an exposure, the mask on mask, again, I want to make sure I understand. That means that if a positive case is identified, but the person identified as being positive was wearing a mask, those within close proximity were also wearing masks, say in a classroom setting, not in a lunchtime setting, an outdoor setting, or an athletic setting, a quarantine would not be necessary under this guidance.
Yeah, so there's kind of two pieces right now. So if it's a mask optional setting, so a school district that does not require masks, if an individual was masked and consistently masked during the exposure with the person that has confirmed positive COVID, that individual will not have to be excluded from schools. And the latest change in this toolkit is that for school districts schools that require masks, if they have their mask off for lunch and that was when their exposure is, they still do not have to be excluded from school.
Okay, I really appreciate all the information that you've managed to squeeze into this presentation. It's been very helpful. Thank you.
Ms. Carter?
Okay,
And then Dr. Martin.
Okay, so I guess I'm going to circle back real quick because that was what I was mentioning earlier. So in Wake County Public School System, are we following that?
So, Ms.
Because I
Carter.
don't see that listed.
Yeah, so Ms. Carter, I think that's something that we have to go back to and revisit, given Ms. Wade's part of the presentation, where now that the testing is a should and not required, we may want to revisit that. But we'll take it back to our team and update our guidance appropriately.
All right, thank you. All right, and I guess I'll circle back to the athletics being an issue, and I like to look at our data since we're talking about our students. And the clusters that are noted on our cluster list, I believe one that high school that's not listed is an athletic on there. It doesn't have an athletic team by it, but I believe it is. If so, that is 6 athletic clusters. If not, it's 5 athletic clusters, and we have 9 in elementary schools. So just want to reiterate that. And I'm going to go to my questions. I guess circling back to some of the numbers, the daily number of people, the hospitalized, because I go to your website and it says with COVID. Do you have any difference between those who are hospitalized due to COVID, their symptoms and severity, or any complications versus those who have a secondary or even maybe further down the line diagnosis of COVID?
Do not believe that we have that, but I'm happy to take that back to our data team and see and confirm.
Okay, thank you. That would be helpful, I think, to know if someone is being admitted and cared for due to COVID versus happening to have it and it's not impacting treatment, if that makes sense. And I understand the number of cases is increasing. And you kind of hit on this just a little bit, but could you explain a little more about the severity of symptoms and how that has changed since March of 2020?
Sure, and with Omicron, as I mentioned earlier, there's preliminary data out of South Africa where it originated that is showing that it is less severe and less increase of people in hospitals from it. But unfortunately, it's all very preliminary at this point, and with everything changing so rapidly, it's hard to draw any conclusions on what we're seeing, and it really should be caveated with that. But that is what early data is showing, and we're hoping to learn more as more data is collected, more time is collected. But at this moment, it seemed that it early data is showing that it may have more impact in the nose and throat as opposed to the lungs. But, as I said, it's really hard to draw any conclusions now with such limited data.
Okay. Well, hopefully in the near future, it can be more concrete. And I guess another question, because, we hear, or I do, a lot of folks that are fearful and have a lot of anxiety about COVID and either going to school or sending their students to school. What information do you have that you can share with our community and with us to help provide hope and to help maybe address some of that?
Yeah, absolutely. I think with the findings that we have from both the CDC Test to Stay pilots and from the ABC Collaborative, it really looks at this low secondary attack rate and this low or no transmission from study participants to others. So it really does provide a lot of information to show that with a layered approach of masks and all the different things within the toolkit and getting vaccinations and boosters and all the different strategies, that there is really the ability to keep spread low within schools and keep people safely in the classroom. And if there's something from DHS that we could do to help provide and share information, please let us know. We'd be happy to try to work with you on that.
Okay. And just a couple, I'll try to be quick. Because I know in the Test to Stay study, and I believe the mask optional data is going to be available, I think, or a preliminary report in February was the last that I had read or heard. But I wanted to go back to what the data that we do have for that. And I know, am I understanding correctly that it, based on the numbers and in the report, that anywhere from 99.4% to 95.3% did not test positive, even though they were exposed in an unmasked setting, but in a masked district. Is that correct?
Within the ABC collaborative findings?
Yes. Going
I
over
do not have that off the top of my head, but I can look and try to get that confirmation for you.
All right, yeah, because I was looking at the report and just the range, and I believe it's 0.6 to 4.7% ended up tested positive. So I think, sometimes for me when and this was kind of going back to what I was hitting on, a positive and a hopeful, to hear 99.4 to 95.3 when you're exposed in an unmasked situation in a masked school, if it's coming out right, that was that was the COVID transmission rate was. So I don't know if that's making sense, but that's why I was asking to clarify. But if I have those numbers wrong, please correct me at some point or email me. And I think that was, I guess, and given that, because quarantines really impact in-person instruction for our students through staff and also students themselves, and I know there have been some change, it just has a significant impact. And when we're looking at, the low rate of, or what I consider low rate of transmission and that information that was shared, do you know, or has it even been talked about? Because we've talked about an end game for masking and whatnot. But with all the changes in quarantine and, it keeps evolving, has there been any discussion about what the threshold is going to be used to determine about the risk to public health is and when quarantine will continue or taper off more, if that makes sense? Because I know I just feel like there's change after change, and I didn't know if there was a specific target or if it's more of the severity, like what we had mentioned before, the severity of the disease itself.
Yeah, I would point back to the CDC, and I have a slide on this too. The CDC, when they released their updated shortened periods for quarantine and isolation, they shared some of the findings with Omicron that help inform that decision. And that's really, I think it's an evolving thing as we learn more about Omicron and, unfortunately, if there's a future variant, and that's really what has informed those changes on the national level is what they're finding in there. And I'm happy to share that resource as well, but it walks through the research that's available out there that helped determine this decision to shorten it down from 5 days from 10.
Thank you. I guess we don't have I guess I was asking for something more concrete like we've looked at, but okay, thank you. I don't know.
Thank you, Ms. Carter. Dr. Martin?
Thank you. A couple points, Ms. Carter, just for clarification, you noted the number of clusters in your elementary schools versus high schools. Note that we have 3 times as many elementary schools as we have high schools. So it's like any time you're dealing with populations, you have to scale it by what you have. Yes, they are larger, but it's number of settings. So something that is worth paying attention to. thank you for the information provided. I want to come back to that. But a question that I have, we hear about, severity and percentages and all this kind of thing. And right now, the CDC says that anything over 100 cases in a week per 100,000 population is high transmission. That's 0.1%. So 1% transmission is 10 times what CDC calls high. My question is that scale a unique scale for COVID, or if we had 1% transmission of the flu, right? A lot of people say it's no worse than the flu, but if we had 1% of the population testing positive for the flu in a week, would that be equally problematic? In other words, is COVID unique, or are these thresholds, the CDC's threshold of the 100 cases per 100,000 population, is that unique to COVID, or would we have that same threshold for the normal flu?
I really can't speak to the CDC threshold in that way. Are you asking about the way that they're doing their county metrics in terms of wearing masks, or guidance around what's considered a high transmissible area in a county?
Well, the mask guidance is sort of secondary, right? The mask guidance, as I understand it from the CDC guidance, is you need to get down to the moderate or low, but as long as you're in the substantial or high, then you should be concerned. So the real question is are these thresholds of low, moderate, substantial, and high, are those unique to COVID, or are those standard for transmissible diseases like the flu? Or we don't want, if you're sick with the flu, we don't want you coming to school and passing it around. So if this were the normal flu, would we be concerned at the similar threshold levels?
I can't speak to the CDC threshold levels. The data that we've been using to inform the Toolkit guidance, as I said, is coming from the research that we have available here at the ABC Collaborative, as well as the CDC pilots that they've done on tested state to show that these are, very low rates of secondary attack in K-12 settings. And we're very thankful to have K-12 specific guidance that we're in research that we can build on, but it is specific to K-12 and doesn't apply to other settings.
Well, I'd appreciate if the question could actually get answered, because that did not answer the question. And I think it's a really important one for us to consider.
Perhaps Ms. Wade can confer with her.
That would be extremely useful, because
us.
there's a lot of people talk about it, compare it to the normal flu. Well, let's compare it to the normal flu. Right now in Wake County, we're close to 3% of the county's population is testing positive in a week, which is 30 times the threshold limit of what is stated to be high transmission. And so we just need to put that into context. I guess the other point somewhat related to this that I think is worth noting here, particularly for the record, is, thank you for providing the data that you provided on the slides. I'm speaking specifically to 11 and 12. I do think it's important for people to recognize that that's the state data, and it's not Wake County data. Currently, the Wake County data is substantially higher than the state data. I do believe that is a result of more testing going on in Wake County rather than a greater infection rate in Wake County. Can't say that for sure, but I believe that's likely the cause. The other thing that's important to note is these data, even for the state data, did not have the data that was released just this morning. I did go back and look at the data released this morning, and obviously the numbers are up, because they always are the week following, fairly substantially. And it's almost, the Wake County numbers right now for the last week reported are, for the 5 to 9-year-olds, 3,265 cases per 100,000 population. For the 10 to 14-year-olds, it's 3,429. For the 15 to 7-year-olds, it's 3,105 per 100,000. So those are substantially higher numbers than this. The point that I think that is really important for this discussion is that 3 weeks ago and 4 weeks ago, the school-age population was below the county average. In the last 2 weeks, that has flipped. So it was a correct statement that last week the 18 to 24-year-olds were the highest cohort. But in both the state and in Wake County, it is now the 10 to 14-year-olds that are the highest, followed by, in Wake County, the elementary school 5 to 9-year-olds. So in the last 2 weeks, we've shifted now so that the children's cases are substantially higher than the rest of the population. And it's also concerning that, I mean, the data is always delayed, so we don't know what's going to happen till more data comes in. But there are only 3 cohorts where the data is still going up based on the report that came out today in Wake County, and that's the 5 to 9-year-olds, the 10 to 14-year-olds, and the 2 to 4-year-olds.
And Dr. Martin, I think this is, unless you have other questions for Ms. Wade, we're going to hear, I think this is a perfect segue for us to hear from Dr. Mashunga.
Perfectly fine. I just wanted to make sure that people understood the data, because the data does not tell the whole story, and it is looking like there are a lot more cases happening in schools. Otherwise, you wouldn't see the inversion of the children's cases versus the general population, and that is both statewide and in Wake County.
Okay, and I think Dr. Mashunga has some data for us to dive into as well. Mr. Coe?
Yep, so then with that, I will pass it over to Dr. Mashunga, who will share her perspective about the Wake County data related to COVID.
Good afternoon, and thank you, Mr. Coe. I have our Health and Human Services Director with me, Ms. Nanette Bowler here as well. So I will go ahead and give a brief update of the data, particularly in Wake County. Now, this information is about a week or so old from last week, just because when different things are submitted, the updates don't happen as frequently. So there might be newer data that came out earlier today. But we can go ahead and go to the next slide. So really, I am giving this opportunity to show just where we are at data tracker from the CDC from the from January 5th through the 11th. And as you can see, the entire state of North Carolina is represented by high spread of COVID-19 within the community, particularly within Wake County. The case rate during this time is at over 2,700 per 100,000 individuals, and positivity rate at that time also at 27%. Next slide, please. And as you're looking at this slide, I have made a slight update here on the information and the data that came through initially on what you have and what's shown here. The December amount of cases per month is actually 30,309, and then the total amount for the month of for the first 13 days of January is 49,940. I showed this slide to show what we have seen throughout the pandemic. We have had surges, our winter surge last year at 21,000 cases during the month of January, and even through our Delta surge through August and September, where we had significant numbers of increases in cases. But we have not seen anything quite like what we are seeing currently, where in the month of December and the first 13 days of January have significantly surpassed all of our cases per month that we have seen thus far within the pandemic. Next slide, please. This next slide is taking a breakdown of the actual Wake County cases by age and is looking at them weekly and showing the total number of cases throughout the pandemic. So going from our winter surge, which you see with last December, we had an elevated surge and increase in cases there, but also starting to see our Delta surge, which was in the August timeframe where we had an elevated number of cases. We also had, and during that time, we started to see increases, particularly in our younger populations and in school age groups. As we go to the more recent data for our more recent surge with Omicron, we are seeing significant increases, particularly in some of our younger age groups within Wake County. Next slide, please. With that, I'm showing also the actual Wake County deaths and what we have seen over the course of the pandemic. We have seen with very early on, before vaccine was available, we had significant numbers of deaths occurring daily associated with our surges at that time. As time has gone on and vaccine has become more widely available, we have seen that number begin to decrease across our populations and across our community. We did have we saw a portion of individuals that unfortunately that died associated with our Delta surge in August and September. And we're continuing to monitor data currently to see if we are seeing similar instances with our current Omicron surge. I know very recently, as recently as last week, there was a study that was released by the CDC and was conducted by Kaiser Permanente, which actually shows very, very preliminary data that shows the amount actually that when comparing Delta and Omicron, there's actually Omicron compared to Delta, there's actually a 53% reduction in the risk of asymptomatic hospitalization. There's about a 74% reduction in ICU admissions and a 91% reduction in the risk of mortality. So very early data, and I'll be happy to share that link with you all here. But this came out last week and just showing what we're continuing to hear, that Omicron tends to be, for most people, a less severe course of disease. Next slide, please. This is looking at the percentage of the population vaccinated here in Wake County. This is comparing Wake County compared to the state of North Carolina. Initially, what you're seeing are fully vaccinated and those vaccinated with at least one dose, and then those eligible to receive a booster. We see that for those 12 and older, 83.6% are fully vaccinated, and those 18 and older, 85% are fully vaccinated. And then our total population is just over 70% fully vaccinated. What we are really looking to see, and what we have been sharing and on our communications and messaging, is just the importance of staying up to date on vaccines and receiving boosters as individuals become eligible. And so what our team has been able to track are those that are eligible to receive a booster, but still have not just yet. So those 12 and older at 58% eligible to receive a booster, and those 18 and over, 56% are eligible to receive that booster. And then for our total population, 58% are eligible to receive a booster. Next slide, please. And then taking a closer look at the actual age breakdown of the populations that are vaccinated, that are fully vaccinated, we're seeing that particularly the most recent age group that has become eligible for vaccine, our 5 to 11-year-olds, are continuing to increase. We're seeing increases weekly of about 1, sometimes even 2% of this younger age group receiving their vaccines. So right now, our 5 to 11-year-olds represent 34% of the population fully vaccinated, and then 66% of our 12 to 17-year-olds. Next slide, please. So another topic and that comes up often is just the difference between individuals that are unvaccinated and those that are vaccinated. And those that have been, we are learning more with this particular variant. It's important that you are up to date and have your booster dose. So really this information from the CDC that's showing the difference between those individuals, the incidence of those that are unvaccinated. And so from October, the unvaccinated person had a 10 times higher risk of testing positive for COVID-19 and a 20 times higher risk of dying from COVID-19 compared to a fully vaccinated person that had either their additional or even booster doses. So it shows the difference that we're seeing between the unvaccinated population, and even shows that difference between those that are fully vaccinated without their booster and those that are fully vaccinated with their booster dose. Next slide, please. And we've talked quite a bit with Ms. Wade and Mr. Coe about the CDC's new isolation and quarantine guidance. Really just reiterating that if individuals test positive, regardless of their vaccination status, staying home for 5 days until they have no symptoms, or excuse me, if they have no symptoms, or if their symptoms resolve after 5 days, they're able to relieve isolation on day 6, but continue to wear a mask around others for those additional 5 days. If they're exposed to someone and if they've been boosted and they've completed their primary series of either of the vaccines, then the recommendation is to wear a mask around others for 10 days and test on day 5 if possible. If they become symptomatic at that point in time, then they should get tested and stay home. If they are unvaccinated or are outside of the window for eligibility for their COVID-19 vaccines, then it's recommended that they stay home for 5 days. And after that, continue to wear a mask around others for those additional 5 days. And I believe that is the last slide that I have, so I'll gladly take any questions at this time.
Thank you, Dr. Mashunga, for your willingness and ability to come and share this data that's specific to our county with us and hear our questions. Colleagues, I'll just remind us that we do have another discussion that's going to be quite robust coming. So any questions for Dr. Mashunga? Ms. Kushner.
And I don't know if this is for Dr. Mashunga or Mr. Coe, but I have a particular concern around the increase of quarantines among students with special education needs that are in contained classrooms. And are we revisiting and examining how to reduce those quarantines? Because I know those students are not able to mask with the same fidelity as some of our other students, but they also have more difficulties with the remote learning. So I just wanted to get an update on that. And Dr. Mashunga, I don't know if you have guidance that can help us reduce those isolation of those students.
Thank you, Ms. Kushner. And I believe you're referring to the fact that when some of our special education students who are in classrooms where they have mask exemptions or they're not able to wear their mask fully are being asked to quarantine for the full 10 days, right? And so that's the guidance we've received because the environment that they would return to after exposure or confirmed positive would require that they are unmasked around others. So the guidance that we have noted is that they would have to do the full 10-day guidance. But Dr. Mashunga, do you have anything to add to that?
I think you've stated it correctly there, Paul, Mr. Coe. We have looked at, those particular settings are challenging, unfortunately, just because, as you mentioned, not being able to wear a mask outside of those, being in that setting and potentially exposing others does present a challenge for that long period of time.
And again, that's another area that can be followed up on in light of the most recent revisions in the toolkit, which were really designed to provide much less quarantine exclusion situations for mask-mandated districts. That's the primary change for mask-mandated districts. This is a mask-required district, and so there's very limited circumstances where a quarantine or an exclusion would be required in the exposure instance. Not talking about symptoms, not talking about positive tests, but in the exposure instance that the quarantines and exclusion have been substantially reduced to really only exposure in the limited situations of a household exposure. Okay. That's really the only required situation where the exposure would require an exclusion or quarantine. And again, that would be if they weren't masked at the time, if they were not vaccinated, and if also if the person didn't have COVID in the last 90 days and recovered from it. So very limited quarantine exclusion requirement now under the toolkit
All right, thank you.
in the exposure setting.
I mean, just as one board member, I just want to express my continued concern around, developing a pattern of expansive quarantines with those vulnerable students. So whatever we can do to keep students in school across the district, but particularly attention with our vulnerable students in contained classrooms. Thank you.
Thank you,
Ms.
Ms. Kushner. Any further questions for Dr. Mashunga? Dr. Martin?
So I'm just wondering, Dr. Mashanga, if you would have a answer perspective to my previous question. The thresholds, the low, moderate, substantial, and high rates of transmission. If this were the flu, a cold, any communicable disease, are the guidelines that we're working with sort of standard in the public health community, or are they unique to COVID?
So I can't speak exactly to that. Really, it's the CDC is making it provides a lot of this. Provides these recommendations that we adopt. But I think one of the things that we're doing is just taking a look and evaluating that both at the local level to really understand that. So I can't provide an exact answer to your question, but I think it's something that we are evaluating.
Can you indicate, in a bad flu year, what would be the transmission rate? Do we have, surely that would be known public health information, I would think.
Yes, but I do not have that information with me at this time.
Okay, I think that I would really appreciate that information. I think it'd be very helpful because, I think that the general question is, we can talk about symptoms. It is or is not that bad. That's one story, but even normal flu, I don't want lots of people coming to the classroom and giving it to somebody else. And so if we could understand sort of a public health reference, that would sure be helpful. We need context for the numbers. Thank you.
Yes, and Ms. Carter.
It's real hard. And I guess I had the same question about the hospitalized folks. Does Wake County have any data that separates out those who are hospitalized due to the severity of their COVID or complications due to COVID versus someone who's test positive and that might not be their primary diagnosis?
No, we do not. The information that we have that at least gives us some idea is looking at COVID-like illness, so individuals that have symptoms of COVID, but that still kind of backs away from what you're asking for those that are truly diagnosed with COVID and are in the hospital being hospitalized for COVID.
Okay, and I'll just state for me, I think that would be important, and that is, speaking of context, a lot of context for some people to be able to understand the severity of the illness and where we're at. And you did share some data about, circling back to the question I asked about, what are some information that you can share to provide hope for folks? There are a lot of folks who are anxious or fearful about going to school with the COVID or sending their students in. So do you mind just going back to that data that you shared? The preliminary, I understand, but I just think it's important to provide hopeful information as much as possible. Thank you.
Absolutely, and like I mentioned, I will share the link to this to the article that was released last week. This was an article that was our study that was done from CDC and Kaiser, and really it's showing that during a period that mixed with Delta and the Omicron variant that were circulating, infections with the Omicron variant were associated with reduced risk of severe clinical endpoints or outcomes. So a 53% reduction in the risk of symptomatic hospitalization, a 74% reduction in ICU admissions, and a 91% reduction in mortality. And that was comparing Omicron to Delta.
Thank you, because I hear that, and that's huge, and that's something that I don't think we're hearing a lot about. So I appreciate any sharing of that information would be great. Thank you. The link.
Always
Absolutely.
good to end on a note of hope. We certainly thank you, Dr. Mashunga, Ms. Wade, and Ms. Creech and Mr. Coe for being here today, and your willingness and your department's willingness to speak to us, to share your information and your insights with us as we move forward and as we learn more about the COVID-19 virus. And I'm looking forward to there being more hope in the future. So thank you. Our next part of our work session is talking about year-round schools. This was something that came out of our facilities committee. We've had a work session on it here, and we will be discussing underutilized schools. And with us today is Mr. Glenn Carrozza, who is now the Assistant Superintendent of School Choice Planning and Assignment. I had to go back and look to make sure I had it correctly. So welcome, Mr. Carrozza.
Oh, it is now. I just want to thank a couple people for their help. Beth Silvera, who I will greatly miss. Really sad to see her go, but she's really been a tremendous asset during this process. So I just wanted to take some time to thank her. Through the Office of Student Assignment, Rob Sywick, Dr. Eric Chansey, and Haley Dodson. They've done a tremendous job in helping put together the information for this presentation. Dan Hoff as well with the maps. So I just wanted to say thank you to all of them for their support. So our conversation today is to follow back up from earlier conversations that we started, I think it was back in October. And then again, it came up in the most recent enrollment plan finalization. So staff has looked at some underutilized schools, and we have some recommendations to make for you today. We're also going to present a metrics that we're going to be using when we're looking at multi-track year-round schools and the potential of shifting them to a track 4 only. Okay? And then, as I said, we'll have some recommendations at the end of this presentation. So I've got a couple slides. You've seen these before, but I wanted to bring them to the public's eye because I think they're pretty important as we look through this process. Here in front of you, you have the elementary school crowding. And when we look at school crowding, 90 to 95%, ideally 95%, is our mark where we really would love to see our schools operating at. And so here, by calendar, you can see the number of schools that are operating at that 95% or greater percentage. So for traditional, you have 46 out of 78, multi-track year-round 13 out of 27, track 4 only 3 out of 10, and modified 1 out of 3. And these are elementary schools. Okay, so we'll be focusing on our multi-track year-round elementaries, again, the blue. And then to visualize that data, here's a map. You've seen this map before. This was presented earlier. Again, the green icons represent the multi-track year-round schools and where they're located. The colorings represent the schools that are experiencing crowding above 90% starts at yellow, then it goes to orange, 100 to 110, and then over 110 at red. So you can see where the significant crowding is. And I think as much as we can visualize a lot of this, I think it's really important for the public and for you to see this as well, because you can see where our crowding is located, okay? Then again, for middle school, I'll just highlight the multi-track year-round middle schools. 1 out of 8 are operating over the 95% crowded mark. And then again, to visualize that. So you can see on both maps are significant amounts of crowding, generally to the west, southwest, it's growing. You're seeing it go from Cary down to Apex, to Holly Springs, and then certainly into Fuquay as we look at our projections moving forward. I just wanted to share the calendar law that allows you to make this possible decision. Specifically, Section 4 is where we would qualify. And this was updated in June of 2020. So what are the factors that we consider when looking at a multi-track year-round school and possibly converting it to track 4 only? there are three major factors that we look at: the utilization, the growth potential, and the feeder alignment. Utilization, we're looking at schools that are at 75% utilized or less. Okay, and the question becomes, well, why 75%? When you're looking at a multi-track year-round school, it provides us the opportunity, when operating fully and appropriately, at a 25% increase based on a traditional calendar or a track 4 only calendar school. Because track 4 only calendar, while it is year-round, does not offer that capacity gain because you're not operating with 4 different tracks and rotating in and out. The growth potential, looking at the capital improvement plan. Do we have any new schools in the area coming or not? What do the long-range projections say about the population growth? Is there new residential growth or not in these particular areas? Those are the other factors that we'll look at and consider. Because the last thing we want to do is convert a school calendar and then turn around and say, oops, we need to convert it back, right? So we're trying to give ourselves a window of information and data so that we can make a well-informed decision. And I'll say this just as a caveat. Since March 2020, I think there's been a lot of uncertainty about our data. We had some very good data leading up to that point, but as we've seen over the last couple years, it's going to be interesting to see what our long-range projections look like and how accurate they are, because it is so hard to predict choices our families are making post-COVID. And then feeder alignment, okay? So when you're looking at schools, an elementary school, certain elementary schools feed to one middle school, or a middle school has elementaries that feed to it. When you look at converting a calendar, you have to look at the impact that those feeder schools have, because they have siblings that are in those younger grades. And so how do we align so that these schools can have the siblings on the same track? Because currently that is a priority for our district. So what I have here is the list of 6 schools that, when you look at their projected utilization for next year, would be less than 75%. You've got Adams Elementary, Middle Creek Elementary, Westlake Elementary, Willow Springs Elementary, Rollsville Middle, and Westlake Middle. So based on that criteria alone, if we were to stop right there, these would be the 6 schools we would recommend. So let's move on to the next criteria. So when we consider the impact from expected growth or the capital improvement plan, 2 schools fall off the list. Adams Elementary, it does have some new growth coming to the east of the school, okay? And Willow Springs Elementary, which is located in the Fuquay area, which would be foolish of us to give up these seats at the time. While it is projected to be under-enrolled, we do have significant growth in the area. So we think it would be best to kind of sit and wait and see how the growth develops over the next several years. And then when we look at these siblings and the lining of tracks, Rollsville Middle School falls off. 2 of the main feeders of the 3 feeder schools to Rollsville Middle School are Stanford Creek Elementary, which is operating at or around 100% capacity, as well as Harris Creek. And so it would be very difficult for those schools to align calendars, moving students all onto one track. So we wouldn't recommend that particular school at this time. So looking at Westlake Middle School, and the reason I bring this up is because when you look at the previous slide, Middle Creek Elementary and Westlake Elementary, which are both highlighted in green, both would qualify based on these factors. And Westlake Middle School, being a middle school that has elementaries that feed to it, let's take a look at how they can accommodate any potential changes. Banks Road, I highlighted in yellow, and I'm going to speak to them in just a second on the next slide, which is a multi-track year-round school. East Garner, which is on the modified calendar, feeds to Westlake, which is year-round. There's never really any perfect alignment when we're looking at modified calendar schools. This is not uncommon to have modified calendar schools feed to either a traditional middle school or a multi-track year-round middle school, or a track 4 middle school at that. So not much we can do to perfectly align the calendars because we cannot convert a school to the modified calendar per calendar law. Vance is already on track 4, as is Walnut Creek, and all of those schools feed to Westlake Middle School. So looking at Banks Road. Banks Road does not project to be lower than 75% utilized, which was one of our first criteria. They are, however, at 80%. Okay? When you look at the feeders, Banks Road students, 1/3 of the students that leave Banks Road go to Westlake Middle School. The other 2/3 will be assigned to the new Herbert Akins Road Middle School further south. Okay? So when you look at siblings and aligning tracks, there are not as many students that they would have to align tracks with when you're looking at if you left them multi-track and assign them to and keep them assigned to Westlake Middle School. It would be a little bit more difficult for Herbert Akins to accommodate track 4 only for 2/3 of the students coming out of Banks Road. And so that's why we're not really looking at a recommendation as of yet for Banks Road, because there is still potential for future growth in the area. As 540 crosses over the eastern part of 401, you're already seeing land being cleared, development coming. Where those students will end up going to school, that's part of our long-range projections. They will be directly impacted, though, with the opening of Hilltop Needmore Road Elementary when that school comes online. It's projected to be, I believe it's 24 or 25, depending on an update we're going to get pretty soon. So staff's recommendation to not change their calendar at this time and to wait to reassess after Hilltop Needmore Road opens. Again, that recommendation is based on the metrics that we have in front of us. So public feedback. As part of this process, once we had gone through the metrics, we did have some public feedback. Back in November, it was actually November 1st, Westlake, there was a Westlake PTA meeting, which Westlake Elementary, Westlake Middle, and I believe there were a couple people from Middle Creek Elementary there as well, right, Dr. Martin? You were in it.
Yes, it was planned by the Westlake PTAs, but the Middle Creek folks were invited.
Okay. So we had met with families. There were staff present. There were families present. We got some good feedback. I know prior to that, the Westlake schools had also sent out their own survey to parents, which was favorable based on who received the survey and responded back to a possible conversion. Then on January 10th, staff held a virtual public meeting to get some more feedback from families. And it concluded with a 3-question survey asking them ultimately, do you support a potential move to track 4 only? Are you very supportive, somewhat supportive, undecided, or I cannot support this decision? And those were the responses we got, and I'll share that feedback with you shortly.
And I'm sorry, who was, just for clarification, who was the targeted group that was surveyed? Not just Banks Road, or not?
So we invited Banks Road families to the meeting. So Banks Road families were invited, Westlake Elementary, Westlake Middle School, and Middle Creek Elementary. Yep, we had over 200 participants at the event. A parent survey, again, like I said, went out, and then we also had the principals send it to all of their to parents who were not in attendance to get their feedback as well. Okay, one school did do a separate staff survey, but that information is not included in the data we are sharing today. So what kind of feedback did we get? Based on the information provided, how supportive would you be of a change from multi-track to track 4 only? Very supportive, had 542 responses out of a total of 1,078 responses. And this was as of Monday. I believe I cut it off at about 5 p.m. So 1,078 total responses, 542, which represents 50%, were very supportive. Somewhat supportive, we had 163 total responses, which represents 15%. So looking at this, you're looking at 65% of the respondents were in support of a move from multi-track to single track, which is almost 2 to 1. You had 10% which were undecided, and then about 26% which did not support this change. Based on that feedback,
Glenn, can I clarify?
Yes, go
This
ahead,
was for
please.
all 4 schools?
That was for all 4 schools, that is correct.
So do you have it disaggregated school by school? What was it pretty similar across all 4 schools? Was there a difference school to school?
I'd have to pull that data. I can definitely provide that to you after this meeting. I do not have it.
I was just curious if you had a sense for it. I don't feel like I need the actual numbers, but if there, if they were all roughly similar, that's
they were
good.
all
If there were an
roughly similar.
outlier, that might be useful to know.
Yeah, they were all roughly similar. We got a lot of feedback, mostly on the 2-to-1 basis that they were in support of it.
Okay.
Which brings us to our final recommendation. The 3 multi-track year-round schools that qualify based on our metrics that we provided today, Westlake Middle School, Westlake Elementary, and Middle Creek Elementary, they would be our recommendation to convert to track 4 only for a 3-year period. And so you may ask, well, why 3 years, right? And I think that falls in line with our reassignment practices of trying not to change a school assignment for a 3-year period as much as possible. I think a 3-year window gives us a very good opportunity to, 1, review the data as it happens real time, make sure that we don't have any significant changes in our projections moving forward, also can provide for some potential delays or changes in the capital improvement plan that we can pay attention to. I think that's a very fair window to give parents to say, hey, if we do this change, we're going to do it for 3 years. And then at that time, we're going to reassess whether we'll look at a conversion to traditional calendar or back to multi-track year-round calendar based on the data we have at that time. Staff, looking at this area, we do have another elementary school coming up in the area, Hilltop Needmore Road. We do have some schools to the north and east of this potential area that are underutilized as well. So we feel like we'll have enough seats, especially in the elementary, moving forward. Middle school, we do have some available seats to the north. The south, we just opened up a brand new multi-track year-round school. Fuquay Varina Middle School will be gaining capacity when they move to their new building in 2024, so we think we will have some eventual seats in the area as well to accommodate this change, at least for a 3-year period. Banks Road, again, I said we'll reassess when Hilltop Needmore Road opens, Adams and Willow Springs Elementary, and Rollsville Middle. We'll continue to monitor these over time. I think this will end up being something we'll look at annually, because trying to be responsible to the public about how we're utilizing our facilities. And then moving forward, this analysis, for any new schools that meet the criteria, we'll certainly bring them to your attention as well. And I'll open it up to any questions you have.
Thank you, Mr. Croza. I'm going to first defer to our 2 board members who have schools on this list. I'm going to start with Dr. Martin, and then we'll go over to Ms. Johnson-Hostler, and then we'll open it to further questions.
Thank you for this work and this recommendation, and for meeting with the families as well. This, I think for the board, it's important to know, this really was a school-initiated request. The PTA worked pretty hard to try to get this to our decision. The school principals likewise. So there really has been a lot of collaborative input on this. There's no decision that everybody's going to be happy with, but I think the 2-to-1 shows you that sometimes we have decisions where the legwork hasn't been done ahead of time, but this is a case where the legwork started the process. So thank you. I think this is a very appropriate recommendation for these 3 schools. The only tiny piece I'll suggest is, you said reassessed in 3 years. The decision is for 3 years. Let's reassess it in 2, so that we don't wait till the end of the time period to do the reassessment. There's a lot of folks were hoping that this decision would have been made back in, November or December, when we voted on the assignment plan this year. The longer we go to make decisions always adds a bit of attention. So I just encourage us we make a 3-year decision, but let's do the reevaluation in 2 years so that there's a year of transition. But this is a sound recommendation that I believe has very much the majority support of the schools. Thank you.
Thanks. And I just want to add, while it was it was nice to have the support from the particular people that would be affected in the area. Staff really wants to keep this to a metric. We do not want to make it where it's, you get parent support and then they want to make a particular change. We think it's really important for staff to have that ability to look at, forecasting forward, because a lot of parents may not have that information that staff has. So keeping that with staff would really be appreciated.
Completely agreed, and I appreciate your metrics, because I think they make sound sense, right? If we're not running efficiently, then we're costing money that could be spent otherwise. So I completely concur with you that the metrics are the reason for the decision. But again, I do want to thank the parents for helping with the legwork, because if the decision that goes with the metrics can be understood and validated, that just goes a long ways. So thank you.
Appreciate it.
Always good when we can partner with people involved in the decision and impacted by it. Ms. Johnson-Hostler.
Which is a little different than what Mr. Crows is saying. So I guess on the other side of this is, to Dr. Martin's earlier question, I mean, because the data isn't extracted, of course, I'm going to get contacted, right, from Banks Road family. This works for Dr. Martin if it's 2-to-1. If it's 2-to-1 for Banks, it doesn't. So I guess I'm going to reiterate, the metrics for me removes the subjectivity and helps parents have the foresight to see it may be what we want at 2-to-1, but here are the actual metrics that the district has put forth. And a part of that, I want to reiterate Dr. Martin's point, if we're going to reassess at 2 years, because I agree we can't do it the third year because that would be the change year, then I think it's going to be important to say Banks is clear. It will be reassessed when Hilltop Needmore is ready and open. Adams and Willow Springs, I would also recommend that your team say, here's when this will be assessed, because I think it helps parents know what we're looking forward to versus making the assumption that there is weight on a parent input versus the district's input. So I think it just removes the objectivity from which one of these measures matters most, but being very clear with parents that this is our metrics. And of course, as board members, it's our responsibility to make sure our parents' voices are heard. But we can also send them right back to here's the metrics and here's when it'll be reassessed. Because certainly for 2-to-1 parents, this is not the decision that Banks Road expected. And both parents from Banks Road and Willow Springs, actually, at the same time, Westlake had it at the top of COVID. When we saw what was happening in our schools, we started to have parents say, well, can we move to track 4? So it's certainly been a long conversation since the end of 2020. And so for me, I can at least point back to here's the metrics for the district, which I think is all most of our families are asking for, is that we tell them how we're going to make our decisions.
And I think just to add, I think one of the things that staff really appreciated from the conversation with the parents was that we were able to get out there early enough to have those conversations and get the feedback. And so, and to address some of the questions or concerns that they may have had. And to dispel any myths that may be out in the community about that process, or what does it mean when we look at a conversion, and to provide the positives and the strengths and challenges for parents so that they can make objective decisions. So you'll certainly see staff reaching out more as we do this assessment for schools. It may not mean that we're looking to make a recommendation, but again, just making sure that they're aware of the potential on the horizon so that they have a longer runway, because that's something that staff has heard from you time and time again. Try to provide parents with as much of a runway so that they can make decisions. So that's what we're hopeful of doing.
And the more that you can say that every year when we are doing assignment, the better.
Absolutely. Further questions? Ms. Scott.
Thank you. Mr. Crows, I greatly appreciate this, as Rollsville Middle is one of the schools that's, we know, is on that list, and they have been concerned about that for several years now. And so I wondered if, when looking at this, I know and appreciate the necessity of having the 3 metrics to follow and to stick to those, but I was curious if we know how many siblings are impacted, like how many students we're looking at who are impacted, just an average number at a school like Rollsville Middle, since that's what's pushed it off. Like, how many students are we talking about?
And I apologize, I didn't bring the exact numbers because when it fell off the metric, it kind of fell off my radar. But it was enough to the point where it would significantly hamper Harris Creek and Sanford Creek, because having to move students to track 4 because they have a sibling means they would probably have to move, well, they would definitely have to move students who are currently on track 4 that don't have middle school siblings off of that track. So it would be duly impactful.
Okay, thank you.
Thank you.
I can get that information, though, for you.
Vice Chair Haggerty.
Thank you. I appreciate the presentation. I just need a little more background and context to understand it a little bit better. Are you aware, of what sort of fiscal impacts like this change will make? Will this change staffing? Is there a benefit to this? It might be a good thing, but is it just like another cost we'll have to plan for? Or how do you think this will impact staffing and budgets?
So it will impact 11 and 12-month employees, and HR will work with employees who want to move schools to remain at that. Okay, so it will impact them fiscally. From a district standpoint, they will not need to provide subs for maybe an 11-month specialist because they have to track out at some point. So when you're underutilized and you don't get funded for all the programs you need to run. So a multi-track year-round school needs a certain enrollment in order to have enough teachers to run its programs till its fullest extent, then the district has to kick in local funds to make up for that. And so therefore, this would prevent these schools from having to do so.
Okay.
Mr. Haggerty, there may be some allotments that are impacted as well that are at a higher level for multi-track year-round schools versus traditional or single-track or modified. So there may be some impact on allotments. There will be impact on employees who are currently 12 months that would no longer need to be 12 months. But there are also some savings from some of these schools that have had to access beyond formula allotments in order to maintain all 4 tracks viable because they don't earn enough through their allotment because they're under-enrolled. So there are savings and places where you might have an impact with the lower allotment as well. So
Okay.
And just to add one piece to it, it's hard to put a number on it, but when you're looking at a multi-track year-round middle school that's underutilized, right? This requires that school to most likely need teachers that are duly certified. And that becomes very difficult, especially at the middle school level.
I appreciate that. And then if you said it before, I apologize if I missed it, but like Dr. Martin was talking about with notification or assessment, this does go hand in hand with student assignment and development of our student assignment plans. And I guess kind of going to a point Ms. Johnson-Hostler had raised about working with parents, when exactly would this begin? If we make this change, it's a 3-year change, we're going to reassess after 2 years. Is this a change we're planning for the next school year or the year beyond that?
So that is up to you. We generally, when we brought this quickly, the recommendation would be for the 22-23 school year.
Okay.
But certainly, if you feel compelled, you can push it off another year. But staff would say, we've done the legwork. The data says you can make that change for the 22-23 school year.
And one additional piece, if the board chooses to move forward with implementing for 22-23, the next school year, we do have a process that we've exercised in the past where HR or other staff will go to schools, like for a faculty meeting, to help the staff understand what those changes mean and facilitate any kind of conversations or other questions that may come up.
Thank you, Superintendent Moore. I just wanted to make sure that, staff have adequate time if they are pursuing the pros and cons of a change, and then families, we're already looking at the magnet application. We'll have the transfer portal open. Will families that don't support the change have an opportunity to shift, to request a change in assignment if they need to for their needs? So thank you.
Yeah. So if you vote on it tonight, we don't need to make any changes. I've spoken with my staff. We can certainly extend the magnet application window another couple of days if you'd like to vote on this February 1st. We can bring it back as an action item. You vote February 1st, and then we'll leave the magnet window open several more days for parents to make any decisions should they want to.
And this is not currently on our agenda for tonight. So, Dr. Martin.
So I would be glad if we could put it on the action item, as an action item tonight. I can tell you that the schools had reached out and hoped to get it to happen for this year, for the 21-22 school year. That didn't happen. They hoped for the decision at the time of the assignment plan so that it could be 22-23. Did not happen. And so, it keeps being put off. You know that I'm normally an advocate for don't make any decision unless you really have the runway. In this case, I think there really has been the runway, and it's my understanding that the schools and families, those who don't want it, don't want it. But those who do wanted it already to happen this year and are really hoping that we'll take action as soon as possible.
That's really helpful to know. I appreciate that.
Okay. Any other thoughts on that time frame suggested by Dr. Martin, which would be voting on this tonight rather than, because Mr. Blumberg, I'm sure there's some procedural things we need to work through. And Ms. Kushner?
I understand that Dr. Martin has been working with the community a long time. I just, just to be more open and allow the community to give feedback, I'm uncomfortable putting it on tonight as an action item, but I'm one board member. But I would prefer to put it on February 1. Given the positive discussion we've had here at the work session, I think we have sent a signal to the community that doesn't seem to be any objection to this, but just for clarity and to stick to our usual parameters of how we approve things, I'm more comfortable putting it on the February 1st. But I understand your sense of urgency to respond to the constituents and the students and the families who have come to you, Dr. Martin. I'm very sympathetic to that.
No, I understand, and that would be, I would normally be making the statement that you just made. So I fully
I'm just channeling you.
I fully understand and fully respect that. This is a decision that has been in the works and people have been working really hard for. So that's where, if this were a decision that was just all of a sudden a surprise, I would not support it at all. But I'm fine if we would rather go ahead and put it on the first for protocol. But I think a lot of the school and families are saying, make the decision. Don't drag it out any longer.
I would say Ms. Kushner's comment is a little more aligned with your agenda-setting policy. It does say that the chair, if action is determined to be necessary before the board meeting, you could add an agenda item before it's an action item before it's adopted. So only really if it's necessary between now and then. So I would suggest that Ms. Kushner's sort of interpretation, at least the spirit of that, would be to hold off for another meeting. I also would really I think you've weighed in, and maybe Mr. Carrozza already feels like he's got the feedback, but for the board to give some clarity about what year you are saying it would go into effect. Is it to start for the start of the next school year, or is it the one after, just so that the action item that comes is clear?
And so if this were to take effect in the 22 this fall, these schools would simply not have tracks 1, 2, or 3 in July, so they would start the end of July with track 4.
Yes, they would start the end of July with track 4.
And everyone would be on track 4. It would be a single track school, which gives a little bit of a further on-ramp than doing it the other way around.
That is correct.
So, Dr. Martin, I appreciate, and fully understand your urgency on this. I think so I've heard from Mr. Carrozza that we can extend some deadlines for families. So if we postpone this to our first meeting in February, we'll be able to make that decision. We had some numbers for Ms. Johnson-Hostler that she had requested. And so I think with urgency, we will make sure that this is put on perhaps our first action item on that agenda for February.
So, Chair Mahaffey?
Yes.
And I know we've talked about, do we have a sense from the board that we'd like to do this in 2022, or are we still waiting for more information to determine if it would be 2022, 2023?
I
would like to recommend that it's 2022-23, or 2022-23.
Yeah.
And staff would just like to clarify, the data would support a 22-23. That's why we're bringing it now. The data could change a year from now, so the recommendation would be for the 22-23.
Okay. I'm just looking at our two board members that who have constituents in those districts. I'm seeing some head nods, and so.
Well, actually, I had my hand raised. I like that
sorry.
Mr. Haggerty's the only one that see my hand. He keeps giving me the okay
I'm
to
sorry.
unmute myself.
Yes.
It's so funny. He was like, "Sure." I know. He's used to being
I'm
over on our
working on it.
side.
I miss being over on that
Actually,
side.
that's not what it is. He is aligned with this side of the table. Thank you, Mr. Haggerty. I would, selfishly prefer, generally I would not be in favor of 2022. I like a longer runway. But this time, selfishly, I'd rather, because then that allows Banks Road to be reassessed sooner than later. So it does give for me, fast track the parents and families who are the ones who want to see this change to track 4 for both my schools, Willow Springs and Banks Road. So selfishly, I have a different perspective than I normally would. So I just want to acknowledge generally I would be in favor of a longer runway. But in this case, I do have 2 school communities who this is not really what they thought was going to happen for them. So,
All right. Dr. Martin.
And if I can just highlight, I think one of the things that came out as maybe one of the biggest concerns in the public hearing is track out availability, which is always a challenge. And there was concern about equity. I think it's important to recognize, as we all have seen, that the multi-track trackouts are extremely challenging, particularly for the lower income families in our community. But I think it would be well for the district to the extent possible, reach out to track out providers, sort of let them know about what's going on and help be part of that communication process. Because I think one of the biggest negatives that came up in the discussion was, what do we do about track out? Now everybody's going to compete for the same track outs. Of course, we also heard one of the principals is on the board of the YMCA, to which for them it's easier to get staff for track 4 track out than it is for any of the other tracks. So there's lots of issues here, but I just raised that. The more we can reach out and work with our track out providers, that can really facilitate any calendar transitions.
I'm being very careful on okay. So Mr. Croza, we will see you back in February. And certainly appreciate you bringing this to us and the work that you and your staff put towards these metrics and parameters so that we can present them to families.
Thank you for your time.
With that, our work session agenda is over. We will return at 5:30 for our regularly scheduled board meeting.